are streaming live from beautiful Fort Lauderdale, Florida. Not the prettiest day out there, and we've got Dr. Barry Jarnagin in Franklin, Tennessee, urogynecologist. Dr. Jarnigan, welcome.
Thank you. Thank you for having me.
So you are just south of Nashville, beautiful Franklin, Tennessee, and you've got a very busy practice with a lot of women coming to see you and asking questions about pelvic floor pain, right? That's one of their big chief complaints. So today's topic, we are going to take a deeper dive into pelvic floor pain and what that means and some of the signs and symptoms, and then we're going to help some of these ladies get connected with you and hopefully get them on a better road to recovery. If you had to kind of characterize these ladies with pelvic floor pain, what would that look like?
So I think the biggest thing that I could start out with is saying that the women and their pelvis, there's a lot more there than uterus, tubes, and ovaries, right? There are muscles and nerves. And when you start really looking at what's going on in the pelvis, the reality is that the uterus, tubes, and ovaries actually get a bad rap. They get blamed for a lot of things, and most of the time, quite frankly, they're not even involved. And so if you look at the pelvis, it's very complex. There's a lot of interactions. There's a lot of muscles and nerves that interact. And if I can just share with you how I kind of talk to patients about it, I talk to patients like their vagina is a room, right? And so you have a doorway, okay? You have an opening, you have a ceiling, you have a floor, and you have a back wall. Within the walls of the room are 2x4s and electrical wiring. Okay. And so if you think of the vagina in that manner, then you start looking at, okay, the 2x4s are the muscles of the pelvic floor, the structure, the things that kind of hold it, the strength of the vagina, if you will. The electrical wiring is the nerves of the vagina and pelvic floor. And so you have the soft tissue, you have a ceiling, you have the anterior vaginal wall that holds up the bladder. Your bladder's in your attic. You have a floor holding and supporting your floor, and your rectum and anus is in the basement. Okay, so if you start thinking of it in simple ways like that, room in your house, you have a door opening, you have ceiling, floor, back wall, you have 2x4s, and you have electricity. Okay, so that's kind of, and so anything within the walls, the 2x4s, the electricity and wiring, all those things can either break and or become dysfunctional. And so that's the thing that we start trying to decipher as people come in is, okay, what has gone wrong and what needs to be done to fix it? And it can be not just something's broke or damaged. It can be simply that it's out of sync. And so you get a lot of out of sync things. And so when when the electricity is supposed to be on, it's off and on, et cetera, et cetera. And so those are the kinds of things that you try to decipher out, try to figure out where's the problem, you pinpoint the problem, and then you start looking at trying to fix it.
So a woman calls your office. How do they normally describe it?
So most of the time they come in, I mean, they just call or they're sent or they make an appointment and they have pelvic pain. And a lot of times they don't know. But there's also a lot of times when people call and go, my left ovary hurts, or my right ovary hurts, or sometimes they'll describe burning. And so those are the kinds of the things that we hear a lot of. And again, most of the time it's not the right ovary. Most of the time it's the muscle that goes up along the side of the vagina, and they're getting pain out in that lateral area, but it's actually muscle pain. And then when I examine them and I hit that muscle, they go, "Oh yeah, yeah, that's it." And their eyes bug out, and they go, "That's it." And I'm like, "Well, that's not your ovary, that's muscle, and that's what we need to fix." And so it requires a detailed exam to figure that out. But they call and they'll say, "I've got pain," or they've got burning, or they've got um, something that in their mind they think is hurting, because that's kind of, unfortunately, that's kind of what the is out there is, if you're a woman and you have pain, it's got to be your uterus, tubes, and ovaries. And like I said, it can be, but more times than not, it is not.
So so how do they get to you? Because there's usually this step process, right? They're gonna see their usual GYN, and what are some of the I guess the acts that lead up to getting to you, right? So what I
Yeah.
think about is how do we shorten that time? How do we, because these ladies go through this very long period and very long cycle before they end up at your doorstep. If we can get them sooner, that's
Well,
that's
you're
that's a
exactly
win.
right. I mean, I see women who have been having pain for 20 years. Uh, and they've gone, they've tried everything, and they're commonly, I will go, I wish you'd have found me earlier in the process instead of at the end of your rope. Um, because the longer pain goes on, it's like anything else. The longer there's a problem, the more difficult it becomes to fix. Not that it's impossible, but it certainly makes it more difficult. I think of pelvic pain as, in fact, I wrote on this. I look at it as how many organs are involved, how long has it been ongoing, and I kind of in my brain stage that pain, right? So if there's three organs involved and it's been 15 years, that's a more difficult problem than somebody who only has one organ involvement, and it's only been a year, right? So, as you might guess, if it's one organ involvement, there's one part of the body that's problem, and it's only been ongoing for a year, year and a half. That's an much easier and much simpler process to correct than the person who's been in pain for a long time. So, again, not that we can't, and we do it a lot, but it would be nice from my perspective to start getting to those people earlier. The other thing that is really worrisome, and I co-authored a paper on this multi years ago, is women unfortunately will tend to go through 5 to 7 providers. They will have unnecessary surgeries. They'll start getting things taken out, uterus, tubes, ovaries, um, and none of that helps because those things were never the problem. And it would certainly be nice to be able to help fix those people before they have to have that unnecessary surgery, because now they have surgery, and now they have, in addition to what they started with pain with, now they have other things that can happen and go wrong as well. And the surgery a lot of times will make things worse, not better. And so it becomes much more complicated. So it would be nicer to get people in earlier. People find me by referral. There's now, people, physicians and uh, physician assistants and nurse practitioners who now kind of know that I take care of people with pelvic pain. And so if they see somebody, they'll send them. There's other people who will find me on their own through the internet. A lot of people, I get more and more people these days who find me through the internet. They're searching and searching, and I have talked on a couple of websites. Pudendal Hope is one of them, but they find me and then they just call on their own and make an appointment. And again, a lot of those ladies have seen multiple providers. They've had multiple treatments, some of which are destructive in nature and make it more difficult to correct. Um, but so it comes from different places. But you're right; it would be nice to find them sooner.
So if I'm local, it's pretty easy, right? Just call the office. Let's get you scheduled. Let's have you come in and have an exam. If I'm out of state, which I know you also have a lot of patients that come in out of state, what's your process like? How do we get in front of you and kind of make sure that this is something that at least initially you can chat about and kind of get some history and some background and before they make that investment to jump on an airplane or drive, a few hundred miles to come see you.
It's almost equally simple. They call the office to make an appointment. We do televisits out of the office. I mean, I will most of the time see people initially by televisit. I see people from all over the country, and we will have a conversation much like you and I are right now. And there's a lot of clues that occur that are very common. And as the old saying go, if you hear hoofbeats, it's most likely horses, not zebras, right? And so um, we, I can tell a lot by what they describe, how they describe it, what they've seen and done and tried before, and I can get a pretty good idea of what's going on. And then, the other things are many women have already had some workup.
Right.
And so they will have a pelvic ultrasound to make sure there's nothing going on in the gynecologic organs, or they'll have had a CT or an MRI, or they'll have had some lab work and some other things. And so other things to kind of rule out other processes. And so by the time I get them on a televisit, most of the time I can get a pretty good handle from their journey so far as to what's going on. If I need to do anything, in the days of technology, we can order labs and uh, any kind of radiologic needs. We can order that in a local place wherever they are.
Right.
A lot of people will get their primary care doctor kind of zoned in. So if we need an ultrasound and there's something or lab work, their PCP can offer assistance in helping to get those things done and get the results sent to us. So there is a ton of stuff that we can get done that will really point us in the right direction before the patient ever has to get on a plane or take a long drive. Once that happens, then we can kind of set up kind of a tentative plan, so to speak, and then if we're going to be doing any kind of injections or procedural kinds of things, we can kind of already have all that laid out. Women will typically fly or drive in on one day. I will see them in the office. We'll kind of confirm what our suspicions are at a high probability, and then we'll have a tentative date set up for the next day to begin treatment. And then they go home, and then depending on whether they need repetitive treatments or what, then we kind of go from there.
So I always think of it as you've got your in-office procedures that you can do in the office, and then you've got ones that either you can do at the hospital or at a surgical center. Uh, what are some of the things that you would treat in your office?
Okay, so good question, and I think it's important to kind of take a second to go. Most of the time, the procedures and treatments that we undergo are fairly simple in nature. We're injecting medications around the nerve or into the muscle, and depending on insurance, et cetera, whether that's done in the office or as an outpatient, there's office treatments. So again, to make people better, to make women better, you have to identify each problem that's ongoing. And so one of the things that can happen is as women get older and or they've had a reason for early menopause, early hysterectomy and had their ovaries removed, or uh, breast cancer, or there's some issue that is caused them to no longer have hormonal support. So so they may have started out with one thing, and now by the time they've got to me, now they have multiple things. And so one of those things can be vulvar vaginal uh, dryness, atrophy, and again, getting back to that room. So that fresh set of paint that you have when you're a teenager, young adult, now that paint has gotten dry and thin, and it needs to be refreshed, right?
Yep.
And a lot of times women will get burning on the outside, burning on the inside. It's uncontrollable. And a lot of times that is simply skin irritation from where that skin has just thinned out, and that paint on the wall, so to speak, has just gotten dry and old and kind of irritated. And so we have laser technology, radio frequency technology that can help rejuvenate that tissue. Like I tell women, put that fresh paint on the wall and get things more healthier. And again, that's one step towards making people better. And I tell everybody, there is no single silver bullet. It's a matter of putting together. You don't make a cake with one single ingredient, right? It's a multimodality thing. I was talking to a physician, an intern this morning who wants potentially to come and rotate, and it's the multimodality. It's treating the vaginal tissues, treating those 2x4s, treating that electrical circuitry. It's doing all the things necessary to get things back into a healthy state. And so the laser and radio frequency technology can treat that fresh paint. It can also treat the muscles and nerves. There's a technology that we have that will treat that muscle and nerve with radio frequency, but it's not the ablative stuff. It's not the things that's going to kill anything. It's the things that's attempted to rejuvenate that tissue, make those muscles and nerves healthier. And that's what our practice is all about, is trying to get the body to heal itself.
Beautiful. No, that's a great way to describe it. I think that if anyone watching this program today, they're gonna definitely learn more about you, your practice. And so, how do they get what's your website so we can share that with the audience?
It's centerforpelvichealth.org
Okay.
is the website, and it's pretty easy. And more likely than not, you can Google my name as long as you spell my last name correctly, which sometimes can be a challenge. It's Jarnagin. If you don't spell it right, it may or may not pop up. But Center for Pelvic Health .org in Franklin, Tennessee. The phone number is 615 284 4664. Or you can send us a fax at 615-284-4668. So there's all
Always to get
sorts
a
of
hold of you.
ways to get in touch with us.
Okay. Wonderful. Well, listen, I'm so pleased to have you on the program this afternoon. Happy Friday. Thanks for taking time out of your busy schedule to chat with us. And I know the ladies are going to learn a little bit more about themselves, their body, and we'd love to have you back on the program here in the near future.
Well, there's all sorts of things that can go wrong between the belly button and the knees in females, and so we're here to help. And I enjoyed the day. I appreciate the time. I'm very passionate about trying to get the word out on how to take care of women in pelvic floor disorders, and I would love to come back and talk about this more or any other topic that might pop up.
I love it. Dr. Jarnigan, thank you so much, and you have a wonderful weekend.
All right, thank you. You as well.